Your adrenal glands are part of your endocrine system, located just above your kidneys. They produce hormones that give instruction to virtually every organ and tissue in your body. Addison's disease is an adrenocortical insufficiency that occurs when the adrenal glands are damaged and cannot produce sufficient amounts of cortical hormones. It's caused by damage or dysfunction of the adrenal cortex itself. With Addison's disease, the production of mineral corticoids and glucocorticoids is diminished, resulting in decreased aldosterone and cortisol. Autoimmune or idiopathic atrophy of the adrenal glands is responsible for 80 to 90% of all cases. Other causes include tuberculosis, histoplasmosis, adrenalectomy, cancer with metastasis, or radiation therapy of the abdomen. Inadequate secretion of ACTH from the pituitary gland is a secondary cause of adrenocortical insufficiency as a result of decreased stimulation of the adrenal cortex. Therapeutic use of corticosteroids is the most common cause of adrenocortical insufficiency. Your adrenal glands are composed of two sections: the interior medulla, which produces adrenaline-like hormones, and the outer layer, cortex, which produces a group of hormones called corticosteroids. When the cortex is damaged and doesn't produce enough adrenocortical hormones, the condition is called primary adrenal insufficiency or Addison's disease. Although rare, this is most commonly the result of the body attacking itself or autoimmune. Addison's disease symptoms usually develop slowly over several months. The disease progresses so slowly that symptoms are ignored until a stress, such as illness or injury, occurs and makes the symptoms worse. Clinical manifestations include weight loss, craving for salt, hyperpigmentation of the skin and mucous membranes, weakness and fatigue, nausea, anorexia and vomiting, abdominal pain, constipation or diarrhea, dizziness with orthostatic hypotension, severe hypotension, hyponatremia, hyperkalemia, hypoglycemia, or hypercalcemia. Depression, emotional instability, apathy, and confusion are present in 20 to 40% of patients. Although the clinical manifestations presented appear specific, the onset of Addison's disease usually occurs with nonspecific symptoms. The diagnosis is confirmed by laboratory test results. Some of these laboratory tests include findings such as an increased potassium, increased white blood cells, decrease in sodium, increased calcium, increased BUN and creatinine, normal to decreased blood glucose, or decreased blood cortisol. Other diagnostic procedures can be done, such as the ACTH stimulation test. ACTH signals your adrenal glands to produce cortisol. This test measures the level of cortisol in your blood before and after an injection of synthetic ACTH. ECGs can be used to assess for ECG changes or dysrhythmias associated with electrolyte imbalances. Radiological imaging such as X-ray, CT scan, or MRI can be done to determine the source of the adrenal insufficiency, such as tumors or adrenal atrophy. The most common complications of Addison's disease include acute adrenal insufficiency or Addisonian crisis, hypoglycemia, or hyperkalemia, hyponatremia. Addisonian crisis occurs when there is an acute drop in adrenocorticoids due to sudden discontinuation of glucocorticoid medications, or when induced by severe trauma, infection, or stress. Insufficient glucocorticoid causes increased insulin sensitivity and decreased glycogen, which leads to hypoglycemia. A decrease in aldosterone levels can cause an increased excretion of sodium and a decreased excretion of potassium, leading to hyperkalemia and hyponatremia. You'll need to get plenty of salt or sodium in your diet, especially during heavy exercise, when the weather is hot, or if you have GI upset such as diarrhea. Your doctor will also suggest a temporary increase in your medication dosage if your body is stressed. You may also want to carry a medical alert card and bracelet at all times. Keep extra medication handy. Carry a glucocorticoid injection kit for in case of emergencies. Stay in contact with your doctor. Keep an ongoing relationship with him or her to make sure that the dosages of replacement hormone are adequate. Have annual checkups. Make sure that you see your doctor or an endocrinologist at least once a year. The National League of Nursing competencies include human flourishing, nursing judgment, professional identity, and spirit of inquiry. Human flourishing is when the nurse helps the individual to reclaim or develop new pathways towards human flourishing. This can be accomplished by speaking to and treating the patient with dignity and respect, making sure to educate the patient about ways to achieve self-actualization and about self-care and disease management. Nursing judgment is concerned with critical thinking, clinical judgment, and integration of best evidence into practice. All treatments for Addison's disease involve medication. The patient will be given hormone replacement therapy to correct the levels of steroid hormones their body isn't able to produce. Solid assessment skills, safe medication practices, and patient education are essential in nursing judgment. Professional identity involves the internalization of core values and perspectives recognized as integral to the art and science of nursing. The embodiment of this can be achieved by dressing professionally and being fully prepared to care for your patients. Practice good personal hygiene, making sure to wash your hands before and after every patient contact, and always conducting yourself as a professional. The spirit of inquiry is a persistent sense of curiosity that informs both learning and practice. The spirit of inquiry may present itself many times throughout a patient encounter. Anytime that I may have an assessment finding that makes no sense with what's going on with the patient's condition, I may need to consult with other nurses and or providers that may have more experience in a certain area than I do. Interpersonal communications are vital to this portion of nursing care.